race and class determine the level of care you get from your doctor? We put that question to our guest, Jennifer Warren, PhD in Health Communications at Rutgers University. Thanks for joining us today.
Thank you for allowing me to be here.
The doctor's creed, do no harm. Is that compromised by racism and classism?
Well, I don't think anybody who becomes a physician wants to consciously be in conflict with their creed. I think there are some situations that present themselves where race and class bear on interaction that are unavoidable. So, no.
Well, that leads me to my next question. I mean, if I get sick, do I have to avoid going? Am I putting my health at risk going to a white doctor?
Well,
does it come to that?
No. You know, it's interesting. There's this concept that in education has been studied for years called stereotype threat, and what happens though is when you prime a person's race in a way that is negative. They had, this is a study, black children and white children. They told the black children that they were, this is an intelligence test. The white kids, it's a diagnostic test. The children who were black did poor on the test. The children who were white did fine. When the blacks were told it was a diagnostic test, they did well. So Aronson and Steele, who did that study 30 years ago, which has been repeated thousands of times in different scenarios, have shown that when you prime or cue a negative stereotype about a person, it can cause them to perform poorly. Hence, going to the doctor, if indeed there is this racial discord or racial difference between the doctor and the patient, and it's not so much the doctor feeling like he or she has a racial issue, it could be the patient having the feeling that they are at threat, that they are fulfilling a negative stereotype or feeling that this situation is causing them to feel negatively about a social group with which they belong. Black, homosexual, it could be any.
So this could happen between black patient, black doctor?
Absolutely. Women, you know, a black man and a black woman, white man and white woman. It could happen with anybody with which a stigma is attached. Obesity is now being studied through stereotype threat. My co-authors and I wrote an article recently about how medical education needs to understand that these cues are real. And what happens is people will disengage or disidentify with the health system, meaning they won't do what they're supposed to with prevention because they won't think that it's part of who they are.
Right. So how do patient and doctor identify that that's going on?
It's a little hard to do that. However, there are things that can be done to minimize the cueing or the priming of feeling like a negative stereotype is happening. Like for instance, having medical residents, new doctors understand this is a real issue and teaching them about this. 1, 2, in clinic, showing that there may be not favoritism, but showing that this is a diverse environment and we are acceptive of all people. 3, allowing the person, the patient, to actually have a voice in their education. 4, I mean in their care. 4, actually allowing the patient to believe that they can reach a goal. Instead of saying things in a negative way, the physicians would say things in a positive way.
How much of this is the doctor making the patient a part of the process?
Oh my goodness, Brian, it's 100%. I mean, you cannot not address stereotype threat without fully engaging a patient. And that's where the issue comes in with the physicians. How much time do they really have in an encounter?
Sure, most of the time you're seeing the nurse for most of the time.
Right, and when
then you see the doctor for a couple of minutes.
And then you're talking heart, lungs, you know, things like that. So, but there are simple things, and the article that we wrote comes up with some simple ideas that we hope would help clinics and physicians try to make their environment more friendly and less stereotype threatening.
Do you find this is perhaps more exacerbated among underserved communities?
Oh, absolutely. Absolutely. I think they are more stigmatized. Now, when we talk about stereotype threat, we talk about domains. So there's like the education domain, and there could be the medical domain. In education, stereotypes abound about blacks being as intelligent as whites, being able to make it through the process of education. I mean, when I got my PhD, I'm not going to lie to you, I felt a lot of racism in that period. I felt threat quite a bit. And so when we talk about the domain for medical medicine, it's the same thing. Those threats exist.
Mm-hmm. So we all just have to be a little more aware, a little more open-minded, and aware of ourselves to I guess, heal this process.
Yes, we want to heal. I like that.
All right. On that note, Doctor, thanks for joining us. Always a pleasure.
Always. Thank you so much, Brian.